everybody. Well, in many respects, I don't know about you all, but I am thrilled about our final plenary session tonight, our final panel, which is tonight. We get to celebrate and honor Carole Hanks, Dr. Carole Hanks, who was a light in our community. And so tonight's plenary will be the Carole Hanks panel on child hunger. And so, but before we do that, I'd like to invite all of our folks who have made tonight possible. The food, the delicious food that's been prepared, the great service that we've all been able to benefit from now for the last couple of days. I'm going to ask that they would all come out, and let's give them a round of applause. Thank you. Great job. It's only fitting that our conference is on hunger and y'all are solving ours right now. So thank you so much. Thank you so much. Well, I'm going to ask Dr. Jenny Howell to come to the stage, and she's going to get us going for tonight.
So tonight we're gathering for the Dr. Carole Hanks panel on child hunger. We're fortunate to have with us public service representatives from the City of Waco, the Texas Department of Agriculture, and the United States Department of Agriculture. The panel, as Jeremy just mentioned, is named in honor of Carole Ann McDaniel Hanks, who passed away this year on Easter Sunday, April 9th, 2023. That was, I'm told, 58 years and 2 weeks after marrying Baylor professor Dr. Tom Hanks, who's here with us tonight. Dr. Hanks, would you? If you.
I'm absolutely certain this is the first time I have ever been applauded for being extremely lucky.
If you have been around Baylor at all, you know that Dr. Tom Hanks is a bit of an institution here. Jeremy reminded me that at Common Grounds there's a coffee drink named after him. So check it out if you're still in Waco for a few days. But tonight we're celebrating the she-Dr. Hanks, Dr. Carole Hanks. She's credited as one of the early leaders of the Nurse-Family Partnership. The NFP is a program that connects first-time mothers with great nurses, both before birth and after birth. Dr. David Olds, founder of the Nurse-Family Partnership, shared the following insight regarding Carole's part in testing, practicing, and validating the new public health program. He wrote, "Hundreds of thousands of families in the U.S. and now 7 other countries are being served by the Nurse-Family Partnership, in large part due to Carole's leadership. She made the world a better place. It's because of her fierce commitment to children and families that this plenary series is named in her honor." So tonight, for our final panel, we are fortunate to hear from experts addressing America's hunger crisis through public service. Thank you to Deirdre Emerson, Eddie Longoria, and Lena Wilson for joining us and lending your expertise to help us all become better informed on ways we as a community can collaborate with you to end hunger. Our panel will be moderated by Desiree Tucker Serini. Desiree is a seasoned executive with federal government and private sector experience. She served in almost every presidential administration since Ronald Reagan. Most recently, she was at AmeriCorps for 3 years as Chief of Staff and Director of AmeriCorps Vista, where she is credited with a model food security initiative. This initiative, which started in the fall of 2020 and is now in 8 states, is a comprehensive and collaborative statewide approach to food security. Desiree is mission-driven, passionate about creating and delivering forward-thinking solutions, aligning resources, building partnerships, and rallying teams to inspire action and to drive social change. She believes in volunteering and giving back to the local community. She's been volunteering, apparently, since 3rd grade. She's on the board here at the Baylor Collaborative on Hunger and Poverty, HCS Family Services, a local food pantry serving over 1,000 households a month, and a volunteer for DuPage PADS, providing interim housing to those temporarily experiencing homelessness. Please join me in welcoming our moderator and our panelists.
No, I did not work in every administration since the Reagan administration, and I'm really thrilled that you now know how old I am. I was really only 10 when I worked in that. We all four are so honored to be here tonight and to speak to all of you and to be here to honor Carole Hanks. What a treat for us. 3 of us were raised by nurses. 3 of us, yeah. So we want you to know that we understand and value nursing. So we couldn't be more honored to be on this particular panel. These 3 amazing people are all public servants. And I think it's really important to think of the government like that. You are serving the public, the taxpayers. That's who's paying you. I had a boss once who said, every time you spend $1, think about how much money is coming out of everybody else's pockets. So it's important to respect our public servants and to applaud their work for the greater good. Let's see, what else did I want to say about this? We have 3 panelists who are working in all sectors of government. We've got federal government and military, ex-military. We'd like to thank you for your service. We've got local government here in Waco, and then we've got state government here in Texas. So we are really, really honored to have all 3 of you here. I'd like to tell you a little bit about each of them. Eddie Longoria, Child Nutrition Director in the Southwest Region, USDA Food and Nutrition Services. He is responsible for the administration of all child nutrition and food distribution programs in Arizona, Arkansas, Louisiana, New Mexico, Oklahoma, Texas, Utah, and 49 tribal areas, organizations. And as we all know, tribal areas really suffer with food security. Since 2009, Eddie has been promoted numerous times with the USDA. In fact, so many times I cut that out. Prior to that, he worked at Homeland Security. And then again, we would like to thank you for your service in the Marine Corps, where he worked before Homeland. He earned a Bachelor of Science in Aviation Management from Southern Illinois University. But you didn't have to go to Illinois for that. No? Okay. And a Master's in Management from the University of Phoenix. Thank you so much for joining our panel. And then Deidre Emerson. She is the Waco Deputy City Manager. And this woman has a lot on her plate. I am really honored to introduce her because I am also on the board of advocates for the Baylor Collaborative, and we are on a committee together, and I'm lucky that I get to know her more. The last time we met, it was quite a to-do because Trump was flying in, and it was kind of sudden, right? Like, how many hours did you have before you knew he was coming?
Just a few.
It was crazy. She has been a public servant since 1995. Deidre leads city efforts on equitable strategies. She oversees city services, including housing, community development, planning, and inspections. Waco McLennan, am I saying that right? County Health District, Waco Transit, neighborhood engagement, as well as manages the Prosper Waco Collective Impact Initiative contract. I don't think the mayor does anything. I am, this is not, the board that we're both on is not the only board she serves on. Many others benefit from her knowledge and collaborative contributions. She is a proud member of Delta Sigma Theta sorority. She earned her Bachelor of Arts in Business Management and Master's in Business Administration from Wesleyan University.
Texas Wesleyan.
Texas Wesleyan. I did have that, but I didn't read it. All right, Lena, last but not least. She is the Assistant Commissioner for Food and Nutrition at the Texas Department of Ag. Lena oversees compliance with the regulations for 12 nutrition programs. She is a registered dietitian, which is why she keeps encouraging me to eat at least one or two of those cakes. She is with more than 20 years of experience in federal nutrition programs. Texas is darn lucky to have her from her previous job in my favorite state where I was born, in Colorado, where she was the director of SNAP. She has a Bachelor of Science in Nutrition from Louisiana State University and a Master's in Management from Lesley College. She is an avid sports fan, and based on all the places you have lived, we need to know what teams.
I love the Saints, and I love the Steelers, and I like the world champion Rangers.
I'm a Cubs fan, so I suffer a lot. So we're here to talk about your experiences and in working as a civil servant. So I'd like to ask you, why did you, as an individual, take this job in the public sector or to address hunger? Lena, do you mind if we start with you?
Sure. So my story is tied to hunger, actually. I was raised in a town in Louisiana, too small for any of you to know if I mentioned it, but we were a family of 8 living in a 2-bedroom house until I was in 5th grade. And what was wonderful is I didn't realize I was poor because within the 3 blocks around me were the rest of my family, my mother's siblings. And so usually I would get off the school bus with my cousins and we would all wander between the houses and we would eat wherever we just happened to land. My parents were both always working, and so I had family members who stood in the gap. It wasn't until 5th grade when we moved away from that tiny little town to a town 45 minutes up the street that I realized something had changed because we no longer had that support system from our family. And although my parents both continued to work, as they felt like they were giving us a better life, they had taken the structure around. So quickly, my sisters and I realized we had to be those who tried to rally the meals in the home. And because my parents did not believe in, quote, government assistance, it was based on the resources that we had in the house. And then we continued to move and improve in our household, and my dynamics changed in high school. Because in high school, our financial status was very different than when I was in my earlier years, but I realized the impacts of poverty because my best friend at the time had been adopted and had some trying situations. And for my 4 years in high school, every day I shared my lunch, whether I brought it from home or whether I purchased it at school with that person because she did not have resources and was food insecure. She and I are still friends. I just was at my 30-something reunion, and we talked about those times, and it was interesting that she still remembered how we supported one another. And so how I actually got into this space was the memories of that and the fact that my desire to, quote, fix hospital food based on a number of experiences with it and improve that, all tie me back to public health. And that is how I began to work in the federal nutrition program, starting with the WIC program. And then I found my passion in school nutrition, and I worked in that avenue for many, many years before moving to state government, at which time I found my passion with the SNAP program and many of the innovations that could happen there to serve more people. And now I'm here in Texas at the Department of Agriculture supporting the 12 federal nutrition programs that we oversee.
Thank you so much. Thank you. You want to go next, Deidre?
Sure. The story is a little bit different, but I actually didn't start out wanting to work in public service. I'd watched my parents, and my father worked in public administration, and his career by trade is a Parks and Recreation director. And so I'd watched him grow up in that area and how many hours he worked. And so I decided that was not what I wanted to do because he worked too much and he was gone a lot. But where am I today? So over time, though, I actually started out after graduating from college. I started out working in private industry, working for Mervyn's, if anyone remembers that store, and left that open. That is it. Yes, that is it. I'm sorry. But after doing that for a couple of years, and I actually began to raise my nephew, I couldn't work those hours any longer. And so the hours that it took working in retail just didn't work for what my home life was. And so I took in a temporary job with the city of Fort Worth, and I started my summer jobs actually I worked in the WIC program. And so, which was very interesting to me by the time I got to Waco, because I have responsibility for public health where we operate the WIC program. And so I have lots of questions on how it used to be and now how it's done today, and there's really no real comparison between the two. But it did give me some relevancy to understand that I saw that as a teenager in college growing up, watching how and going from center to center and providing paper vouchers is what it was then, and now it's electronic. But I just made the decision that once I started working in public service that, and seeing how communities were, not necessarily how my community was, but how communities were and the conditions and the things that people were having to live and work through, that my choice was my role in this world is to make that better. And so this is not work that I do because it's about me, but it is about the people that I serve and ensuring that their quality of life is much better than what it is.
Thank you so much. Eddie?
Thank you. So I grew up in Los Angeles, California, in the San Fernando Valley. You may have heard it before. There's a town by the name of Encino, California, in Calabasas. That's where Michael Jackson and the Kardashians live. I grew up on the other side of the valley, which we didn't have Michael Jackson or Kardashians. In fact, they would not go there. It was a very poor area, lots of crime, lots of drugs, to the point where I was told as a child not to go outside. And I told the folks the story earlier that my mother was a nurse, but that wasn't until I was a teenager that she became a nurse. And so prior to that, we lived in poverty. And I didn't, to Lena's point, I had no idea what poverty was. Everybody around me was living the same way, so I didn't know any difference. But the one thing I remember the most about living in poverty is government cheese. It is the greatest cheese on the face of the planet. I don't care what anybody says. If you haven't had government cheese, it is the best cheese. Anyways, best grilled cheeses ever, and quesadillas, and so on and so forth. But long story short, I grew up there, and at the time, I didn't understand what college was. I didn't know that college was a choice. Where I grew up, that was for the rich kids, and I wasn't one of them, so I just figured I'd go get a job when I graduated from high school. And so a high school counselor said, you know, we see something in you. You're getting okay grades. You could probably go to the local community college. And I said, okay, well, you know, I'll give it a shot. And I got a job working at UPS, because that's kind of what you do. That's a great job. That's kind of what you do, and you work at UPS, and then you go to school part-time, and I got my, when I went to go and pay for my first bill for school, I said, there's no way I can pay this. I don't have this type of money. I never had to pay for education before. Why start now? So I came home, had a long talk with my dad. He says, you got to get educated. And I said, Dad, it's so expensive. I'm not going to do, there's no way. He goes, there is a way. He says, you should consider joining the military. And so I went and talked to my local Marine Corps recruiter and enlisted in the Marines. And while I was active duty, earned my bachelor's degree while on active duty. And when I got out of the Marine Corps, right before I got out, fortunately married my wife, who is from Texas. And it tells you who wears the pants in the family. Where do I live? I live in Dallas. So, but long story short, I come back. I get out, and I just needed a job. And I got hired on with Homeland Security. 9/11 had happened. I was able to get hired on with Homeland Security, and my degree's in aviation management. So I said, I'm going to go into aviation, and I'm going to do something in aviation. And so I got into aviation security, and I was doing a lot of security work for the federal government. And I realized, in fact, I remember coming home one day from work so upset. And my wife says, what's wrong with you? I said, I don't know what is wrong. But long story short, I wasn't happy. I wasn't happy doing that work. And I didn't know why at the time. But I told her, I said, you know what? I'm going to go to graduate school. And I'm just going to use my Montgomery GI Bill and get my master's, and we'll see where that takes us. And went to school at nighttime, part-time, and earned my master's. And as soon as I graduated, I started looking for jobs. And I noticed that there was a job with the United States Department of Agriculture WIC program. And the first thing the first question I had was, why are feeding programs in USDA? I don't understand that. Like, I didn't get that. Long story short, I meet a gentleman by the name of Bill Ludwig. Many of you know him, Bill Ludwig. He's our regional administrator for the Southwest region. He hired me as his WIC director. And I'll never forget my very first speech when I went up on a stage in Oklahoma, and they said my bio and said I was a Marine and I was Homeland Security. And oh, by the way, now I'm in charge of women, infants, and children. And I said, I bet you everyone's asking, like, how does a guy from the military and Homeland Security get to breastfeeding? Like, how does that work? And I think it was more of my management style and being able to lead. And since then, I was able to get promoted up to the position I am in now, which is the child nutrition director over all of the Southwest region of the U.S. And over my career, I've been very fortunate to not only be responsible for WIC and the child nutrition programs, but also SNAP and all of the USDA feeding programs. I've had great opportunities. I've gotten to work in Washington, D.C. But at the end of it all, the one thing that drove me to this world was not feeding people, because I didn't understand that. It was helping people. And I didn't learn that until I had got this job and realized, oh, this is my passion. Like, this is me, man. I'm going to do this, and I'm going to do it really, really well. And so that's where I'm at now. And fortunately, I have a boss who believes in me, and I've been very fortunate. That's my story.
Thank you so much for that. I might ask you later to tell us a little more about your mother, because that was pretty impressive and I think made you who you are. What did you all learn in your positions during the pandemic? I know you didn't work very hard then, and you were just sitting around twiddling your thumbs on, nonstop Zoom meetings. But why don't we start with you, Deidre, if you don't mind?
Sure. Actually, during the pandemic, I didn't work much. I'm kidding. I'm kidding. I actually wound up having to manage and lead our COVID-19 response, because we found ourselves without a public health director. So I became the public health director during COVID-19. And so as part of our response, at the time being the deputy city manager, working alongside with our mayor, we developed different work groups. So in addition to doing the public health response, I had to do my regular job as a deputy city manager too. So, but as part of that, we developed these work groups where we saw and developed, whether it was financial security, workforce, small business, but we developed those, and in each one of those work groups, we could really see the impact that COVID-19 was having on our community, and how, and figuring out ways to bring the community together to meet and solve those needs. And so whether that was reaching out to our churches, reaching out to the bigger business owners that had the resources, and figuring out ways to ensure that people were collaborating together. So one of the things we really saw help a lot, because there was a lot of food insecurity, and how the children were being served meals at schools. And so working in conjunction with Waco ISD, along with the churches, and ensuring that we could provide them the resources, and ensuring that their health was being taken care of at the same time. So if we were having a vaccination drive, then we also had food being served we ensured that there was food being given away at the same time, because we wanted to make sure that we were addressing all the needs of the family.
Thank you. Eddie?
Yeah, so I was a little busy during pandemic. So I think that the pandemic was a horrible experience for everyone. I mean, we lost family members, friends, so on and so forth. It was a really tough time. But I will tell you that from the USDA, I saw things happen that I had, in all my time in the federal government, had never, ever seen happen so fast. And we're not known for doing things quickly. We usually take a while to get things done in the federal government. But there was no denying that the importance of ensuring that people across the nation had access to food, because that was a major vulnerability in our country. And I heard someone say it earlier, I think it was Betty Wiggins, if you're in the room, in her session. She talked about during the pandemic how school food service workers were known as lunch ladies, but all of a sudden became like the people who everyone depended on, right? Because of all the waivers that the USDA allowed for our states to implement, and so on and so forth with our school food authorities. But we were able to do things like, grab and go, curbside meals. A mom or a parent could go and pick up food without the child being in the vehicle. We made sure that every child had the access that they needed. But one of I think was something that we learned a lot from the pandemic, but one thing that really taught us a lot is the Meals to You program. And I say that, I can never mention the Meals to You program without recognizing, at least from USDA, who worked and who worked so hard on this. And I'd like to ask Mark Spate to please stand up, because he was the USDA representative who made sure that happened. Thank you, Mark, for your work. But during the pandemic, there was a lot of sleepless nights. My wife, if she was here, she would tell you that I probably slept in the first 3 weeks of us shutting down and just the country shutting down. I probably slept anywhere between an hour to maybe 2 hours a night, just making sure that everyone had the access. And knowing what it's like to be hungry really scared me. And I thought, there are kids out there who don't have access, and that terrified me. And I wanted to do everything that I could to ensure that those children had access and had what they needed. So we are the federal government, and we are here to help. Seriously, we are, I promise that, especially in the USDA Food Nutrition Service. We truly, truly mean that. And I think that the pandemic really showed what the federal government is capable of, and how we can react and stop on a dime and ensure that all of the people who we serve have what they need when they need it. So that's what we learned.
Thank you. Lena?
So I learned during the pandemic that we had to be nimble and flexible. I saw the stars and superheroes out there serving meals, and we completely shifted the way we operated at the state. And yes, we are a compliance arm, but our focus was not on compliance. Our focus was on the main priority, making sure that people were being fed the meals that they needed. And we shifted to more of a supportive role. Basically, we took whatever feedback we were receiving from school districts about barriers, and we hounded USDA for waivers. We were tenacious because we were saying the old way would not work under the current circumstances, and they were responsive, and those waivers allowed us to do so much. We started having weekly calls. Every week, we were on the phone with the districts on Zoom, thank goodness, just trying to support them, trying to determine what they needed, what was working, what was not working. We were talking to one another, and I think it was helpful because it gave us perspective. A lot of people had no idea on the work that were being done at the school districts because you really never pay attention. It just happens every day. And many of us who know that during the school year, there are only a few days that, you know, the administrators are concerned about kids eating and they're tied to testing. But all of a sudden, they realized that if kids were not getting meals every day, they were not eating. And so we were able to leverage that, and we were able to get people who had never shown any interest in school meals to say, how can I support my staff? How can we get them more money? How can we get them the respect? How can we now understand that they are professionals? Many people thought that, you know, the quote cafeteria ladies meant that these were uneducated, unskilled people serving their kids, and they realized real quickly that they were running these tremendous businesses and that they were able to gather everyone to make a response that mattered. And so our role really shifted to support. And I think what we have learned since the pandemic is we don't really need to do it the way it used to happen. And I think the pilots and so forth that have happened and with non-congregate have been an opportunity to say we acknowledge that the way we've always done it is not going to be the way forward if we want to continue to make sure that there aren't all these gaps. In one of the sessions that I sat in over the last couple of days, there was a graph put up that showed the increase in participation. I think it was John, I think you had that slide up in 2020, and then it showed how it plummeted again in 2023. So we can't go back to what we used to have because that might look like a number on the graph, but what it really is a picture of all the kids who needed meals in the summer and who did not receive them.
Thank you so much. I think we all learned a lot from the pandemic, but I think you hit the nail on the head. We quickly pivoted, not only in the government, but in the private sector, nonprofits, churches. It was amazing, and I think we'll do studies. I hope we'll do studies about what we learned from that time and how we can really quickly adjust, because it was amazing. And you all were the examples of how people really pivoted quickly. Do you think that the federal government is slower than state and local? I have an opinion, but I'm not gonna.
I have no opinion.
Okay, so I won't put Eddie on the spot for that. He wants to keep his job. So where do we go from here? And I'm just going to throw out some thoughts here, and you can talk about any of them. But the summer electronics benefits. My understanding is, because I didn't know anything about this before I was doing this panel, is that is a 30-year-old program, right? So, what's the future of that? Do we need to change it? Home-delivered meals, need for strengthening congregate meal programs, or is there some interesting vision for the future on how we can make these changes based on what we have learned over the last 4 or 5 years? Do you want to start, Eddie?
So I think that going back to our last question about the pandemic and what it has taught us is USDA is really focused on what have we learned, and now we're coming out with new tools to ensure that during the summertime, children have access, regardless of where they live, whether it be in an urban area or in a rural area. But the key is the new rules are set to come out mid-December. So we're looking forward to seeing what that's going to look like. But we do know that our summer EBT program, we're really excited about that. It's an opportunity for children to have over the summertime an EBT card that will have a $40 per month loaded on it during the summertime. And they can also participate in the summer food service program at the exact same time, which is unheard of. But really getting away from congregate feeding to non-congregate feeding and opening that door to ensuring that children have access, regardless of where they live, all summer long.
Deidre?
I think that, as Lena stated, the nimbleness and the flexibility are things that we have to continue to have. Not necessarily around the food insecurity, but one of the things that we have really done is expanded from Wi-Fi or access is that we've really done a lot of work around our community centers and our libraries to expand that, so that from a learning standpoint and just access in order to know and look up, families have the ability to look up things and know where they can go to receive services. But the nimbleness and flexibility has to remain. I mean, we're still doing it now, and there's still some things that we sometimes say we'd like to pull back on, but we can't give that up because we know that we have to go to where the people are. We cannot continue to think people will just come to us.
Thank you.
So in terms of where do we go from here, I think what we have learned over the last couple of days is we have got to be a louder voice on the need for these meals and the services that are provided. I was shocked in some of the sessions about how many of us who are actually interested in hunger and poverty were not even aware of some of these programs ourselves or in the room. So when we were talking about them, there were a lot of questions that show that that message is not resonating widely enough. And no matter how many resources we have on a website, I think we need to work together a little bit better to spread the message. There are gaps. All of these 12 nutrition programs that we're talking about, we're operating, they all fill a gap, and we need to make sure that those who are advocates in the communities who are trusted and churches are aware of these programs and that they are sounding the horn that they're available, and not allow there to be this perception that I won't take advantage of that program because someone else needs it more. That is really not the message, because it's not either or, it's and. And as a collective population, we need to say that more and connect more and make sure that we are supporting one another with the resources, so that, you know, we have information on our website, but many in the community don't realize you can order them from us and we will send them to you free of charge. You know, so how can we do a better job? And I think some of that messaging has to be improved moving forward.
Thank you so much. I can't remember, did I ask you this one? Yes.
Yes, you did.
Okay. My next question is, and you know, here, I'd like to say something about that. I learned at one of the sessions too today, something very interesting about people who are food insecure are not getting food because they think someone else might need it more. That tells you a lot about that population, and makes me understand even better some of the roadblocks that exist that we need to overcome. So thank you for making that point. So we've all, not really me, but other people have worked together to address child hunger. Both the Baylor Collaborative, the Texas Department of Agriculture, the mayor of Waco, who we have up here, and resulting in many more meals served in the summer and adding breakfast. However, since COVID, as you've all discussed, the participation has dropped off. How do we change that? Why don't we start with Lena?
So I think we changed that by realizing that we all have a part. I think for far too long, people have thought someone else will do it. And when we all think someone else is going to do it, nothing gets done. And I don't think we can continue to point the finger and wait for someone else. I think there are going to have to be a lot more discussions, a lot more coordination to make sure that these services are getting to those who are in need. For example, at the Department of Ag, one of the things we are doing is in instances where we lose a provider for services in a particular area, we have now, previously we would just say someone else will eventually step up and contact us and they'll cover that territory to make sure there are meals available. We are now proactively reaching out as soon as we know there's going to be a void, and we are reaching out saying, would you assume this area? Would you partner with this person? Is there a church in the area that we can rely upon? And so I think it's going to take more proactive outreach to find people who are passionate about this space, because it is hard and you get tired and you feel like the lift is a lot at times. But you have to just remember what the goal is on the other end, and know that if you don't do what you can, that children may go hungry.
I'll just briefly say that, as Lena said, the collaboration is important. And the collaborations that not only from a local level that I can gain from being in this space, in this room, serving on the Board of Advocates, because through, whether it's our summer programs, after-school programs, or seniors programs, we have the ability to impact and change those lives and what their access is. And so, but knowing, being in spaces like this to understand and know who has what and where to go to get it in order to bring that back locally and share that with our churches and our service providers, so that we can broaden the access that needs to happen.
Go ahead.
And I'll just quickly say that back in 2010, Baylor, Collaborative on Hunger, TDA, and USDA, we partnered and we went across the state and we got the word out on the importance of child nutrition, and specifically on summer. And we saw our numbers grow tremendously, and then COVID happened. And that kind of slowed everything down. But during that time, prior to COVID, what we recognized was it was all of you. It was all the organizations who are all doing pretty much the exact same thing, or I should say the same thing in maybe a little different from each other. But ultimately, our goal is to ensure that people across the state of Texas have the access that they need to free programs that don't cost anything. The federal government is here to pay, and we want to do that. And we want to make sure that every child, every person in the state of Texas has the access that they need. We can do that again. We can really see those numbers grow. Especially the summer food service program or summer feeding, because when we talk about the National School Lunch, nationally, about 33 million kids participate in the National School Lunch program across the nation. And in the summertime, only, I don't even know the exact number, but I know it's a lot less than that, who are actually participating in summer feeding. USDA's hope is that with the new tools that we're allowing states to implement, that can help. But at the end of the day, to Lena's point and to everyone's point, is you gotta get the word out. We gotta work together. We have to talk. We gotta make sure all of our local officials, everyone who ties into this, is doing something to ensure that children have the access they need during the summer.
I think that's critical. That's one thing I've learned in this process, is that we need to get the message out, and that's really, really important. We just have a few minutes more, but I wanted all of you to talk a little bit about, we're together at this table, not this table, but these tables, and how are you working with people that are here at these tables? So the private sector, the other aspects of the federal, or of the government in general, All of you work with USDA, of course, but I'd like to hear a little bit about your collaboration with your partners.
Okay. So at USDA, we work very closely with the same agencies that serve the same people that we serve. And that's Health and Human Services, that's the various programs, but Rural Development also is one of our sister agencies in USDA. We have a big focus on rural development and rural hunger. So we partnered with them in various ways, especially at the rural development housing centers, where we provide summer feeding at those locations. But one of the big ones that we partner with from a local level with counties in Texas is through our DSNAP program. So whenever there's a disaster, we ensure that folks who live in the disaster affected areas have access to food for replacement. Because if you have no electricity, you don't have healthy food or good food in the refrigerator, right? So once your electricity comes back on, we want to make sure that all of those folks who are affected by a disaster have the access that they need. And so we work very closely with local and city governments to ensure that the folks who are affected have the access they need by issuing a Disaster SNAP EBT card. But we continue to look for ways to help those in need, and there's no way the USDA can do this alone. It's just impossible. We need everyone in this room. We need everyone in the state of Texas to ensure that we're fulfilling our mission, and that's to ensure that we end hunger and folks have the nutritious security that they need.
Thank you. Deidre?
And also that we spend a lot of time locally working with our federal partners for sure. One of the big things that we're working on right now is we are developing a STEAM Center for Excellence within East Waco. And so part of that facility will have a commercial kitchen. It has a kitchen, and we will renovate it to become a commercial kitchen, but we are also working with entities like the USDA to help us figure out ways to fund so that we have an open air. The way the building will be designed is so that there will be gardens so that folks that can go out and they can grow their food, and then they can come into the commercial kitchen and learn how to cook the food properly so that we can make people understanding how to serve themselves as well as go out and teach others the same way.
Sounds like a model program. Do you want to say what STEM is? Because I just learned about that about a month ago.
Science, technology, engineering, and we add A for art and mathematics.
Right. That's a new term. Lena, if you can finish us off.
So what I would say is we work, I know Eddie feels like I have him on speed dial. He and I talk often, and he
Daily.
can call me as well. But I will say that, one of the partners who we work with closely that I have not acknowledged is our food bank community. And it's very important that we consider them because, one of the things we do is when they have legislative requests, we show support for them because we understand that makes them operate better, and in the end, that helps folk in the community. They administer some of these programs for us, and especially during the pandemic and with supply chain disruption, it has been important for there to continue to be a pipeline of food to provide services. And so they have been really, really good partners. We have coordinated what is shipping, what is not shipping, what does USDA forecast is going to be available, what is not going to be available, so we can give them a heads up so that they can make sure that they continue to have food to provide to the community. So all of the partners, school districts, we continue to engage with them because we need to know what they need so we can advocate for them. And it may not seem like that's the role of state government, but it really is our role to advocate for the needs of the partners who are actually delivering the services. And we accept that and we acknowledge that, and we just believe that we're better together and we can all work together to make sure that everyone is fed that needs access.
Lena, that was perfect to end. I'm just going to add one note. Probably all of you know this, but when you're in the government, you cannot, you can educate your legislators, you cannot advocate. And I'd like to make the point that kind of as a call to action, that is your job. all of you who are not in the federal, state, or local government. It is illegal for them to lobby legislators. And so that is your call to action. That's one of the biggest things, besides all the other work you do, that you can help make this process better, to get better laws, to get the Farm Bill passed. That's kind of my last call to action. I'm honored to be with these three amazing people who are public servants serving us all. Thank you.
I'm going to let Jeremy have the last word, so I'm going to hit you with the logistics, and then I'll invite him to come up. Just a few things. One, how are you going to get out of here? The buses are right outside the door where they drop you off. And so once Jeremy's done talking, you all can head toward those buses, and they'll take you back to McLean Lot 3. I mentioned this at lunch, but we'd like to know your thoughts about this event, about using the app for this event. For those of you that are returners, this was the first time. And so you should be getting a notification from the app maybe tomorrow, as well as an email reminding you to complete the app or complete the survey. Several of you I know have expressed that you took notes or pictures, but used the app to store the knowledge you've gained over the last several days. You will have access to that for the next 3 months. So do what you need to do to get those notes, into your handwritten notebook, if you will. But you'll have access to that for 3 months. And then finally, if you look on your tables, the centerpieces are not just for decoration. You can plant them, you can eat them, and they are yours for the taking. So please take plants with you. I think there are even more still on that back table. And so please don't let those go to waste. We thank you all for being here, and that concludes my portion. So Jeremy, feel free.
Well, as Heather Taylor said earlier today, when she quoted Martin Luther King Jr., the arc of a moral universe is long, but it bends towards justice. And if there's anything that you learned over the past 2 days, is that we can make that arc a lot shorter if we work together. And so I think that you have no excuse. Now you know that no one organization or one sector can end hunger by themselves. And you know people well now that work on a local, state, and federal level. You know people that work in the nonprofit sector, in industry, in research. You know people that work in public service, and you know people that work with faith communities. And so if we all work together, we definitely can bend that world towards justice. I want to thank our panelists. What a wonderful job. Can we thank them one more time? What a wonderful note to end the summit on. You guys did such a great job, and it's so neat to hear the heart behind all of the policies that y'all make us follow. So thank you for that. Really appreciate it. I also want to say thanks again to Dr. Tom Hanks and to his wife, Dr. Carole Hanks, for their commitment to the cause of justice in our communities. Baylor Collaborative on Hunger and Poverty staff. I'm going to ask you all to stand up. You all have worked tirelessly, and I'm going to particularly pick on. I'm going to ask a few folks to raise their hand because they worked extra hard as a part of our summit planning team. Marcus, Tasha, Elijah, Jill, Patty, Amy, Riley, and Callie. And then I also want to recognize Heather from Institutional Events. She has been behind the scenes working tirelessly to be able to put that on. Thank you. you may be seated, with the exception of Grace. None of this ever happens. Everybody knows that B-Chip runs on Grace. So, great job. Grace did a phenomenal job, and it always does, putting this summit on. I would say that she could do it in her sleep, but about the month before summit, she doesn't sleep, and so she's on Eddie's schedule, 1 hour a night, I think. Well, you are the helpers. You are the helpers. So thank you for taking your time out of this past week to attend our 2023 Together at the Table Hunger and Poverty Summit. Go in peace. Thank you.